Hello, my name is Iqra, and my research topic is female genital mutilation. What exactly is female genital mutilation? It is an invasive and painful surgical procedure that is usually performed on girls before puberty. This method is implemented without the use of anesthetics or ethics. Various sources estimate that about 60 to 140 million women across the world have been circumcised. On an average, that's about 4 girls a minute that continue to be mutilated. Mainly, it is being performed in areas of northern Africa for millions of years. There are 4 major types of FGM. 1. Clitoridectomy, which is partial or total removal of the clitoris, which is a small, sensitive, and erectile part of the female genitals. 2. Excision, which is partial or total removal of the clitoris and the labia minora with or without excision of the labia majora. 3. is infibulation, which is narrowing of the vaginal opening through the creation of a covering seal. The seal is formed by cutting and repositioning the inner or outer labia with or without removal of the clitoris. 4. are other harmful procedures to the female genitalia for non-medical purposes, which include pricking, piercing, incision, scraping, and cauterizing the genital area. Consequences include recurrent bladder and urinary tract infections, cysts, infertility, and increased risk of childbirth complications, which usually lead to newborn deaths. The causes of FGM include a mix of cultural, religious, and social factors within families and communities. Areas in which these procedures take place are doing it to ensure abstinence among the communities. They believe that the only way to maintain purity in females is to remove this organ and sew their vaginas so that no man approaches them till the day to get married. It is associated with cultural ideas of femininity and modesty, which include the notion that girls are clean and beautiful after removal of body parts that are considered male or unclean. It is prevalent in western, eastern, and northeastern regions of Africa, some countries in Asia and the Middle East, and among certain immigrant communities in North America and also Europe. It is a social custom, not a religious requirement by any means. People seem to associate this with the religion Islam, but it is actually performed on a social and more cultural basis by Amanists, Christians, and as well as Muslims. The international response to this epidemic was first initiated in 1997 by the World Health Organization, who issued a joint statement with the United Nations Children's Fund and the United Nations Population Fund against the practice of FGM. The World Health Organization efforts to eliminate FGM focus on developing publications and advocacy tools for international, regional, and local efforts to end FGM within a generation, and also to generate knowledge about the causes and consequences of the practice and how to eliminate it, how to cure for those who have experienced FGM, and develop training materials and guidelines for health professionals to help them, treat them, and counsel women who have undergone procedures.